am back with another video. Now, this week I want to talk about Bone Health 102. So previously we talked a little bit more about how to keep your bones strong as you age, but we didn't really talk about some different things you can do with exercise and diet and nutrition. So that's what I want to cover today. So it's really important to understand that most of the time when it comes to bone health, your body is going to actually break down injured bone and rebuild it with stronger bone cells. That's called Wolff's Law. So if you have excess pressure or excess wear and tear on a joint, your body will actually enlarge the bone to counteract and be able to support that weight. So it's really important to understand that when we want strong bones, we actually have to build up not only our bone density, but the muscles that support that bone. Because when muscles pull on the bone will strengthen in that area. So when it comes down to it, it's really important to understand that your bone health depends on how you load and pressurize the joint. So it's very important to realize that exercise has a huge part and impact on your bone density as you age. If you're not exercising regularly, if you're not putting pressure on your whole entire posture from the top of your head down to your toes, or you have poor posture where you're putting pressure on certain areas, that can be a big issue. So I usually recommend we want to make sure we're getting good posture. So if we have a lot of poor posture, you're rolling your shoulders or your head forward, we want to do exercises to counteract that so your head is over your shoulders are pulled back, and the body weight is going all the way down to your ankles. So if you have good posture, perfect. We're going to start from there. If you don't have good posture, let's work on getting you up to good posture. Then it's really important that we're loading our bones throughout the day. So the more weight you put on your bones, the more those bones are going to densify or get more dense and prevent osteoporosis or risk for fractures when you have a fall. So once you've got that good posture, it's really important to make sure that we are loading our bones. So doing walking, doing jogging, especially if you're playing sports, so things like golf, where you're using not only walking on the course, but also using upper body strength to hit the ball and having to use all of the muscles of the upper body and the core to swing your club and hit the ball. That's a great exercise you can do. When it comes down to it, if you're not a big fan of walking or jogging or doing golf, you can also do resistance exercises. Now you can use your own body weight, you can use stretchy bands, you can use a weighted vest, you can also use hand weights, or even going to the gym and doing an exercise class where they're combining your body weight and doing calisthenics or doing resistance exercises. There's so many different ways that you can do exercise to, number one, strengthen your muscles, but also put more pressure on those bones. So that's kind of the top thing that I recommend when it comes to building stronger bones, is building that muscle and loading those bones so that they can densify. The number two tip that I have for you today is more focused on our eating habits. So it's really important to understand that in order for your body to build more bone and build stronger muscles, we need the right nutrition. Your body uses enzymes and also makes hormones and builds your muscle based upon protein levels. So a lot of times as we age, our digestive system kind of slows down. We don't produce enough stomach acid, and that slows down. We get a reduction in that. So a lot of times if we're eating protein, we may feel full for a very long time period. I usually recommend making sure you're getting at least half your body weight in ounces. So if you're 100 pounds, that means at least 50 grams of protein every single day. Now, there's been some studies done that found that if you do protein levels up to 100 grams a day, you're going to have a much better outcome with preserving muscle mass and also keeping your bones more dense. Because let's face it, when we have bigger muscles, you put more pressure on the bones and you actually keep not only your muscle mass, but your bone mass along with that. So really important to make sure you're getting enough protein. Now, like I mentioned, as we age, we do lose some of our stomach acid. So if you tend to have issues with heartburn or reflux, or you tend to feel full for longer than an hour after you eat, we may need to add a digestive enzyme in to help make sure you're breaking down that food and absorbing that calcium properly. Because like I said, protein's super important. But if you're not getting enough protein or you're not digesting the food that you're currently eating, you may not be getting all the nutrition from that. So protein's super important. Another thing that's really important is making sure you're getting vegetables. So vegetables, especially vegetables that are green or yellow, so like onions, broccoli, Brussels sprouts, parsley, things like that, those are rich in not only your B vitamins and your C vitamins, but C vitamin is actually really important because that not only helps to absorb some of that nutrition better, but vitamin C has actually been shown to improve bone density. So make sure you're getting plenty of vegetables. Ideally, you want to make sure you're getting at least 7 servings of fruits and vegetables throughout the day. Usually I recommend a minimum of 5 servings of veggies so that you're getting enough. And like I said, you want to focus more on green and yellow when we're looking at bone density so that your body is getting exactly what it needs. And then the number 3 thing that I want to talk about today is going to be more focused on supplements. So like I mentioned, if you are having issues with digestion, you may need a digestive enzyme. If you've already had some issues with stomach pain and heartburn in the past and a digestive enzyme irritates your stomach, you may actually need to regrow that mucin layer in your stomach. So there are some supplements we carry here in the office to help regrow that mucin layer. One of those is licorice root. If you have high blood pressure issues, we may need to look at another option called DGL that doesn't have any risk factors for those of you with high blood pressure. Another thing that's really important is to make sure, like I said, you are getting calcium. So if you're not getting calcium or having trouble digesting that digestive enzyme can help. You want to aim for about 1,500 milligrams of calcium per day between food sources, and sometimes you might need some supplementation of that too. Another really important thing is make sure you're getting vitamin D. Now, typically, vitamin D levels, especially in the Midwest, we don't really get much sun exposure or the white wavelength of sunlight coming in for us to make our own vitamin D. So in many cases, most people do need to supplement if their vitamin D level is not where it should be from food alone. So I usually recommend getting your vitamin D level tested at least twice a year. Usually I recommend in fall before winter starts. So if you are deficient, you can get that level up and it doesn't affect your mental capabilities or affect anxiety, depression, or bone density issues throughout the winter months. And then I usually recommend getting it tested again at the beginning of summer just to see if you need to, again, do some supplementation. Typically, if your vitamin D level is 30, now 30 is just enough to prevent rickets. So if you're around 30, I usually say we want to increase that. Our goal for vitamin D I usually recommend about 45 to 50 is our goal for our vitamin D level. And that's going to make sure that not only do we have enough vitamin D for brain function and muscle function, but bone density too. And it's also really important to realize that if you are taking a vitamin D, you do need to make sure you're taking it with a fatty food because your body, vitamin D is fat soluble. So you absolutely have to have a fat broken down with it so it can absorb and be used inside of your body. So I know a lot of vitamin Ds out there, especially ones by prescription, are literally just vitamin D and nothing else. I know we carry Active D in our office, which is an active form of vitamin D that also has the fatty acids in it, so it absorbs right away. And it has vitamin K because vitamin K has actually been shown to improve bone building and actually preventing bone breakdown. So that's going to help with osteoporosis or osteopenia risk so that we can keep your bones strong and make sure your muscles are nice and strong so that we keep those bones and our muscle mass nice and strong and don't lose anything as we age. So thanks for tuning in on Health and Horsepower today. Hopefully you learned something.